Today, Italian authorities reported the deadliest day yet from COVID-19. 368 lives lost in 24 hours.
Una, due.
Here's one grim measure of the toll on Italy. In this regional newspaper, the obituary section grew from 2 pages in February to 10 pages this week. More than 1,800 people have died. Italy stands out as the hardest hit Western country so far. Terence McKenna spoke to doctors there to see what Canada might have to brace for.
Today, Codogna, Italy, population 16,000, looks like a ghost town. The residents ordered to stay in their homes. Apparently, this is where the Italian coronavirus outbreak began on February 18th, when a 38-year-old athletic male with breathing problems was repeatedly turned away from his doctor's office and the local hospital without being tested. He unknowingly spread COVID-19 to dozens of people over several days. Dr. Lorenzo Cassani is a hospital administrator in the area.
We know that patient 1 went in and out at least 3 or 4 times from the emergency room, so he spread the virus to other patients and also to the healthcare workers.
In Italy, the virus spread quickly from the smaller towns in the north to the big city of Milan. Then it exploded. Dr. Giacomo Grasselli leads a COVID-19 task force there.
We were watching, images, movies TV from China, and we saw them building up 2 hospitals in a week. And I said, well, this is crazy. Now I completely understand why they did that. It's like a bomb of patients that blows, and then they just come out every day from some 60, 50, 60, 70 new patients. And it's a challenge of how to find a place for each one of them. So it's incredible what's happening. I mean, it's a very bad experience, very bad experience.
Now all the hospitals in northern Italy are stretched to the breaking point. The healthcare workers totally exhausted, themselves terrified of contracting the virus and passing it on to their own families. Ventilators are the only thing that will keep the sickest patients alive, and there may not be enough to go around. Doctors have to decide who lives and who dies. The elderly and those with complicating medical conditions might be sacrificed.
So if you have to choose between a 75 years old person and a 20 years old person, who you're gonna decide? Obviously the person with the higher expectation of life. There will be a moment that an anesthesiologist will have to take off the respirator from the 75 years old guy and give it to the 20 years old. And this will be an horrible choice.
Now, effectively, that means that some people are being left to die because it's not possible to treat everybody.
Professor Yasha Monk of Johns Hopkins University has studied the ethical dilemmas of what used to be considered battlefield medicine.
I can only imagine how psychologically devastating it must be for the doctors and nurses involved. They're already at great danger to themselves, working around the clock in an extreme situation, seeing many people die. And now you add on top of that the psychological stress of having to look at a patient and say, I'm not going to be able to do anything for you. It's hard to fathom.
Yes, it becomes overwhelming for sure. But I have to say that doctors and nurses are doing, I would say, a heroic job. They are saving really thousands of lives and working night and day to grant everyone the best possible care.
There is a debate about why Italy was the first major Western country to be hit, especially since it was among the first to ban flights from China. Some people point to the average age of the population, the oldest in Europe. Some point to the bad air pollution in northern industrial areas that has caused widespread lung disease.
In the northern region, we have the most polluted air in the Europe, and this is linked with viral infection, pneumonia infections. Also, we do not have emergency plans for pandemics. We have it for the natural disasters. And also we were the first, so we were totally unprepared.
I think the question of why Italy is the most important question, and it has a simple answer. No reason at all. The only thing that makes Italy different is that the first couple of cases arrived in Italy about 10 days before they arrived in Germany or the United States or Canada. So if other countries aren't going to react in an extreme way right now, they're going to become Italy.
There have already been over 1,800 COVID-19 deaths in Italy. It has the highest mortality rate of any country, even that of China. Many suggest it is because there is still a vast number of actual infections that have not been diagnosed. Canadians are cautioned not to be reassured by the much lower number of deaths so far in Canada.
My message to Canadians is that many countries around the world have thought something about them makes them less susceptible to this virus than others, and that has proven wrong in every case. Canadians are not miraculously exempt from dying from this disease, and they're not miraculously exempt from seeing it spread in an exponential fashion.
The problem arises when this starts in a small communities with a lot of people. When every people gets infected, it's like it's called super spread. It becomes more and more powerful, and then it explodes. So if you are able to identify the first cases and to contain them, then you might be safe, or at least safer. But I would not wait until you have 10, 20, 30, 50 deaths. That's not the way to do it.
The good news is that we know what can work. Canadians can look to South Korea, they can look to Singapore, they can look to China to understand what they have to do in order to avoid mass fatalities. And that is canceling everything now. Social distancing, staying at home, bosses telling their employees to work from home if it's at all possible, schools closing. That is what is needed now in order to save lives.
This week, a team of Chinese infectious disease experts arrived in Rome to help fight the Italian outbreak. They brought almost 2 million surgical masks and hundreds of ventilators and defibrillators for intensive care units. Having been the origin of the worldwide pandemic, China is now in a position to help confront it. As each day brings hundreds of new deaths in Italy, all Western countries study the Italian example of what could be in store for all of us in the weeks ahead. Terence McKenna, CBC News, Toronto.